And this presentation is primarily for those who are getting ready to sign up for Medicare or deciding if signing up now is the right thing to do. And then if they have all their financial ducks in a row, so to speak. And so without further ado, I'm just going to turn the floor over to Alicia Jones. Oh, but one quick thing, please, if you have questions, use the chat feature. Just type them in the chat feature, and we'll ask our guests at the end of the presentation if they haven't answered them already. Thanks so much. Take it away, Alicia.
All right. Well, thank you, Kelly, and thank you, Union Bank, for having me on today. And I'm excited. Anytime I get to talk about Medicare, I get excited. So let me go ahead and share my screen. I want to make sure everyone can see what I am showing, and then we'll go ahead and get started. All right, Kelly, if you would just confirm for me, you can see my screen.
Roger that.
All right, perfect. Okay, so what I am here today to do is talk to you about Medicare, how Medicare works, what Medicare covers, and how and when you're going to sign up for the program. So before we do that, I do want to tell you a little bit about our program, Nebraska SHIP. So who are we? Why do we exist? And some of you might already know this. If you're on Medicare, maybe you've helped a family member with Medicare. Once you're on the Medicare program, if you actually want to talk to your insurance, Medicare itself, there's only one way you get to do that. You call an 800 number, 1-800-MEDICARE. You wait on hold for a while, and then eventually you get routed into these big call centers. You're going to talk to someone in California, maybe someone in Florida. That is the communication that you get to have with your insurance once you're on Medicare. There's not actually a Medicare office locally where you can sit down and have a discussion. So because of that, the federal government offers a grant to every state to serve as that local in-person Medicare counseling. So I actually work for the Nebraska Department of Insurance, and we get the grant for the state of Nebraska to run our SHIP program. So SHIP stands for State Health Insurance Assistance Program. And we are here to provide free, unbiased Medicare education and counseling. So we do have 7 locations across the state. Our main office is in Lincoln. We're off of 8th and Van Dorn, but you can also find us in Omaha, Norfolk, Kearney, Grand Island, Beatrice, North Platte, and Scottsbluff. So really anywhere someone is across the state of Nebraska, we should have an office fairly close to you where you can actually come in and get that in-person interaction and get those Medicare questions that you have answered. So best part about our program is everything we do is completely free and is completely unbiased. So what I mean by that is, we don't sell insurance. We don't promote products. We don't promote companies or agents. We're here really to make sure that you understand how Medicare works so that you can make a good decision for yourself. If you need to get a hold of us, you'll see on the screen there our 800 number, and it's 800-234-7119. And if you've got any Medicare questions, feel free to reach out to us and we'd be happy to answer those. I'll give you a quick warning. It is Medicare open enrollment right now. So those phone lines are pretty busy. If you call us between now and December 7th, there's a good chance you might have to leave a message. We'll call you back within that day. But right now with open enrollment, those lines are pretty busy. All right, so that is about us here at the Nebraska SHIP. Let me tell you, let's move on to the Medicare side of it now. So really big question is, what is Medicare? When you think about Medicare, really all I want you to think about is health insurance, because that's all Medicare is. Medicare is health insurance that's run by the federal government, and it was created in 1965. So it's a program that really has been around for quite some time. In order to get Medicare benefits, you have to belong to one of 3 groups. Now, typically when we think about Medicare, we think of it's for people, when they reach a certain age. And definitely that's one group that qualifies, but those aren't the only people who get Medicare benefits. So to get Medicare, you belong to one of 3 groups. First group And the largest group of people who get Medicare are those who are 65 or older. So for most people, they qualify for the Medicare benefits the month that they turn 65. Now, we do have a smaller group who qualifies because they're disabled. So these are people who are under the age of 65. They've applied for Social Security disability. Social Security has approved it. Now they're getting monthly disability checks. Once that person has received a disability check for 2 years, on that 25th month of disability, then they get Medicare benefits too. And the last group, and definitely the smallest group, are people with end-stage renal disease, and that's permanent kidney failure. So when you think about the groups that Medicare insures, it's a really big, diverse group of people. You know, we could have 100-year-old on it because they meet that age requirement. We also work with some children because they have ESRD. So it doesn't necessarily mean you're of a certain age to have Medicare, but most people on the program are 65 or older. All right, so I made that sound kind of easy. Just health insurance, no big deal. I think we can all agree that in general, health insurance is complex, and Medicare does take that to another level. You know, typically when you buy health insurance, you're buying one package, you know, one plan. That one plan covers everything you need it to. You take that card to the doctor, to the hospital, to the pharmacy, and you just carry that one card with you. Medicare itself covers all of the same benefits that your current health insurance covers, but Medicare does it in a unique way. Medicare breaks those benefits into parts, and what you're going to do is create the combination of parts that best fits your needs. So what you see on the screen right now are the 5 different parts or components of the Medicare program. We have Medicare A, Medicare B, Medicare Supplements, Medicare D, and we also have Medicare C, or we usually call them Medicare Advantage plans. Each one of these parts covers something unique and has unique costs. So what I'm going to do next is just break down these parts for you, tell you what they cover, what they cost, and if that's something you might want. Now, before we do that, when you look at the chart in front of you, yes, there are 5 unique components to Medicare, but really the way I like to think of it is you have 2 options. You can get a combination of the first 4 parts and they work together, or you can get a Medicare Advantage plan. So yes, 5 components, but really think of it as I have 2 routes to take on my Medicare journey. All right, so let's move on to actually talking about what these different parts cover. So we are going to start with our first parts, and we call these 2 parts Original Medicare. And you'll find we're very creative in the Medicare world. We call these Original Medicare because these are the original parts of Medicare. When Medicare was signed into law in 1965, this is what it was made of. So what we've got is Medicare Part A and Medicare Part B. So we'll start with Medicare Part A. Medicare Part A, we typically call the hospital insurance or the hospital coverage. There's a really good reason for that. The biggest benefit most people get out of Medicare Part A is an inpatient hospital stay. So if you're here in Lincoln and you happen to get admitted to Bryan or get admitted to St. E's, Medicare Part A is what would help you pay that bill. So we've got inpatient hospital stays. Part A also covers skilled nursing facilities. And a good example of that would be a place like Madonna. You know, maybe you're in the hospital and you need to go to Madonna to get some short-term rehab. That's a skilled nursing facility. We also have home health care and hospice covered under Medicare Part A. So Part A only covers 4 services. They're 4 pretty big services, 4 fairly expensive services, but really just 4 things. I like to think of Part A as being the best part of Medicare because it's the free part of Medicare. And it really isn't free. This is the part of Medicare that as you were working, you were paying taxes towards Medicare. Those went towards Medicare Part A. So as long as you or your spouse have worked at least 10 years and paid your taxes, then you've already paid for Medicare Part A. When it actually comes to enrolling and starting Part A, you don't owe anything to have that coverage. While you don't owe a premium for Part A, there are still costs associated with Part A. So we've got deductibles and we've got copays. So on the screen, you'll just see a snippet of what potential cost you could have with your Medicare Part A. If you were hospitalized and you had that Part A, right now that hospital stay would run right under $1,500. It would be $1,484. Also, if you had to go to a place like Madonna and it was Medicare covered, first 20 days don't cost anything. After day 20, then you will start paying a per day amount. So as you can see, Part A doesn't charge a premium, but there are still costs associated with it when you need to use it. All right, so we'll move on to our next part of Medicare, which is Medicare Part B. And I usually call this the medical or the outpatient portion of Medicare. So Part A does everything inpatient. Part B does everything outpatient. So this is going to include things like visit to the doctor. Maybe you need physical therapy. A lot of surgeries right now are done outpatient. And another big one is medical equipment. So maybe you use a CPAP machine or some other type of equipment. Everything I've just mentioned is going to be covered under Medicare Part B. Most services that you're going to have done will be Part B services. Unlike Medicare Part A, which again is the best part, it's the free part, Part B does have a monthly premium. The standard premium currently is $148.50 per month. So keep in mind, Medicare is a program that is for individuals. You don't buy family plans on Medicare. So that $148.50 is per person per month. So that means if there's two of you, you each are going to pay the $148.50. So you owe that monthly premium to have the Part B coverage. When you actually use it, there's also going to be other costs associated with it. So Part B does have a deductible. It's a pretty reasonable deductible. This year it's $203, but you owe that deductible first. Once you've paid that, then Medicare kicks in. Medicare is going to pay 80% of the bill, and you're going to owe 20% of the bill. One important thing to note on this slide are the words no out-of-pocket maximum. And that really is something to consider about Medicare A and B. With most insurance, you have a maximum. You have a limit as to the amount of money that you can spend in the year. You know, maybe it's $3,000, maybe it's $4,000 on your insurance, but you know you can't be responsible for anything more than that. Medicare itself does not have that. There is no time where you've spent so much money and you're just done spending. If you get $1 million bill on Medicare Part B, you owe 20% of that $1 million. And for that reason, that's why we have the other parts of Medicare we're going to talk about. They are really going to help you kind of cap those costs. All right, so that was a really quick and basic Medicare A and B. So now you know what it covers, you know what it costs. Let's talk about how and where you sign up for Medicare A and B. So there are different ways you sign up, and I'm going to do this kind of in two different scenarios. So we've got the first scenario of someone who is turning 65. Maybe they're retired or they're self-employed. Whatever the case is, they can't get insurance from an employer. If that's you, if you're turning 65 and you're not getting employer insurance, that means you need to sign up for Medicare when you turn 65. You're going to use your initial enrollment period, and you're going to sign up to 3 months before your 65th birthday through 3 months after your 65th birthday. So Medicare gives you that 7-month window around your 65th birthday to enroll in the program. So again, if you are someone who can't get insurance from an employer, then you need to sign up for Medicare at age 65, and you can do it up to 3 months before the month of your 65th birthday. You are going to sign up at our friends at Social Security. So you're going to go online to socialsecurity.gov. That's the easiest way. If you don't feel comfortable doing that, give them a call at the local office. And hopefully soon the Social Security offices will be open for visitors again. And when that happens, you can go in and sign up in person. So that was for people who don't have employer coverage. But we do have a lot of people who are going to work past age 65. Or hey, maybe you're retired, but your spouse is a few years younger and you're on their work insurance. If you turn 65 and you can get coverage, insurance coverage from either you or your spouse's current employer, then you get to make that decision if you'd rather have Medicare or you'd rather stay on that work coverage. You're not required to enroll in Medicare if you've got coverage from an employer. Now, a lot of people choose to pick up A because it's free, so that definitely could be something you consider. The other thing I'd really like you to consider is how good is your employer insurance? Sometimes I think it seems maybe easier just to stick with that employer insurance. That way you don't have to make any changes. But if it's expensive or the coverage maybe isn't what you need, you definitely should give Medicare a consideration. So I encourage anyone and everyone, regardless of whether you're working or not and you get that work coverage, please come see us 3 months ahead of your 65th birthday. We'll help you compare the work coverage to Medicare. Then you can make sure you're making the best choice for you. If you do that and you decide, hey, looks like this work coverage is the best choice for me, know that you don't have to sign up for Medicare right away. You can stay on that work coverage until you get ready to retire or that work coverage ends. At that time, you get what we call a special enrollment period. And all that means is you've had coverage from an employer, so you didn't take Medicare. This is your special opportunity to take Medicare because you're retiring. If you happen to miss that, you do have a once-a-year opportunity to enroll in Medicare. Hopefully you don't use that once-a-year opportunity, the general enrollment. If you do, more than likely you're going to have to pay a late enrollment penalty. And that means your monthly premiums are going to be higher. So please make sure you get your Medicare in place either at 65 or when you retire from that employer. All right, so that was Medicare Part A and B. What I am gonna do is, Kelly, I don't know if we're gonna stop and take some chat questions or if I have any, or I can move on if I don't.
We certainly can, if you'd like to take a moment to answer now. I will
Yes.
just take it from the top.
All right, perfect.
Okay. A question could be what the younger spouse options are while the older spouse is on Medicare until the younger is eligible for Medicare.
You know, that's a great question and something we see all the time. If the older spouse was the one offering the insurance and that younger spouse doesn't have work coverage anymore, you could look at things like COBRA, although that's going to be expensive. Or you could look at the marketplace, which is healthcare.gov. I would probably start with healthcare.gov because there's the potential you could get premium help with it, and that insurance would be less expensive.
Okay, thank you. If you have health insurance through a spouse employer plan, should you still enroll prior to age 65?
You know, I would say you just need to kind of take a look at that insurance and see if it's a good fit. If it's not, absolutely switch over to Medicare. If it is, you've got the option to stick with it. It is not necessary, though, to have both Medicare and the employer insurance in most cases.
Perfect. And what happens if you are in ACA when ready to sign up for Medicare? Does ACA cancel automatically when Medicare kicks in?
That is a great question. And what I will say about that is you need to reach out to the ACA insurance and have a discussion with them before you go on Medicare. They will not automatically cancel it. So you need to be proactive and cancel that in time.
Perfect, thank you. Are there versions of SHIP throughout the country as I live in Massachusetts?
Yes, absolutely. So there are 54 SHIPs across the country, one in every state and territories. So absolutely, people can find a SHIP program wherever they're located.
Thank you so much. Okay, here's another good one. I'm 64, retired from the railroad. I have insurance coverage until I'm 65 next May. When exactly should I apply for Medicare?
All right, I suggest you do that 3 months ahead of time. And I would say your first stop should be our office. We can kind of help you plan out that timeline and let you know when you need to, actually make those enrollments. So, but 3 months is going to be a good timeline. And
Perfect.
I see, Kelly, those are kind of rolling in here.
They are.
How
Should
about,
we keep going?
yeah, let's go
Okay.
ahead and we'll keep going, and hopefully we'll have a chance to answer the rest of those at the end.
Okay, and I just wanted to let folks know that we do have a really helpful download with a timeline as well. I mean, we have visiting the SHIP office on that download, but we'll be sending that out to all attendees. So between us and Alicia's really helpful office, we should be able to get you started. And Alicia, here you go.
All right. So we are on to our third part of Medicare. So we talked about the hospital, the Part A, the Part B, the medical. The next part we're going to talk about are called Medicare Supplements, or sometimes we call them Medigap policies. Those two words mean the same thing. So with the Medicare A and B, you saw you still have deductibles and you still have copays. So Medicare Supplements are designed to come in behind your Medicare and pick up the deductibles and copays on your behalf. This is optional insurance. You don't have to buy it, but if you choose to, you're going to buy it from an insurance company. So again, this is insurance you buy privately, and they work with Medicare, and they pay your share of the bill. On the screen now, you'll see the supplement charts that include the different levels of coverage, and you'll see these on top. And then on the left-hand side here, you'll see the items that they cover. So with a Medicare supplement, along with Medicare A and B, this is really how you would find that 100% coverage. You know, I always call it the, I don't ever want to get a bill again in my life type of coverage. It's not uncommon you'll hear people on Medicare say something like, oh, you know, I was hospitalized or I had a big surgery and I didn't get a bill for it at all. They didn't get a bill because they chose to purchase a Medicare supplement. So if that's the kind of coverage you're looking for, one where you pay premiums and then you don't worry about what anything else will cost, a Medicare supplement is probably the option that you're looking for. With these supplements, there is a really wide range of premiums. And, you know, as you saw on the last screen, we've got different levels of coverage. Some supplements cover just a few things, some cover everything. So that definitely accounts for some of that premium range. The other thing I want to make sure you're very aware of, though, is within one plan, a plan G, for example, and a G is the one that covers basically everything. We're going to have 50 different insurance companies that sell those Gs. Every one of those 50 companies has to offer you the exact same product. They all are selling a G, so they're all covering identically. But what will not be the same is how much they charge you monthly to have that coverage. So it's really important on these supplements that you are out there shopping just to make sure you are getting the company and the option that you're looking for. When it's time to start looking for supplements, I'd suggest you give us a call. We can actually get you quotes from all 50 companies, so you know who's going to charge what. You'll also have a history of how their rates have been increasing, how many people they insure, and a lot of really good information to help you make that decision on which supplement you might like. One important thing to know about these supplements is when you can sign up for it. So with the supplements, that is the one part of Medicare that can be the most difficult to get if you don't get it right away. Everyone on Medicare has a one-time guarantee to purchase a supplement. And this happens when you're new to Medicare, when you first enroll in that Part B. You get 6 months to pick a company. In that 6 months, they cannot turn you down. They have to accept you. If you want to try and make changes after that 6 months, then you will have to go through medical underwriting. So really think of that first supplement you have as the one you potentially could have for the rest of your life. All right, so that was a basic on supplements. I am going to move on to the next slide just to make sure we get everything in. And if you had supplement questions, hopefully we'll get to those at the end. All right, so to finish out our first option, we have Medicare Part A, Medicare Part B. You get the supplement to go with it. Then we also have Part D prescription drugs. So a Part D plan is a plan that you're going to buy that only covers prescription drugs. That is its sole purpose, is just to help you cover those prescriptions. With a Part D plan, there are monthly premiums, and there's a range because we have 22 different plans, so somewhere between about 7 up to about 100. Once you've paid that monthly premium, you can also expect to pay a deductible and copays for your prescriptions. With these Part D plans, it is really important that you are out there shopping for them to make sure you get the best deal. The Part D plans are also something that you can change every year. So unlike those supplements where you're kind of locked into them, with a Part D plan, you can pick a plan that's good for prescriptions better. So how and when you sign up for this? Well, you're going to sign up basically at the same timelines as you sign up for A and B. If you take it at 65, you're going to get your Part D plan to go along with it. If you wait until after you retire, you can hold off on the Part D, and then you can pick it up when you retire and you pick up the rest of your Medicare. With the Part D plan, easiest way to sign up is on Medicare's website, medicare.gov, and that is something that we help you with. All right, so I just want to give you a quick recap so you understand how much you've spent in premiums if you selected this first route. So with this first route, remember you've got 4 separate components. You've got your Medicare A, which doesn't cost you anything. You've got your Medicare B, which is $148.50 right now. The Medicare Supplement, that Plan G, on average is about $130. And on average, a Part D plan's around $40 a month. So that means if you've selected this first option, you've spent a little bit over $300 a month on insurance. Also keep in mind that's $300 per person per month. So if there's 2 of you, you're looking at closer to $600 for this insurance. So this is one route you can go. And I like to think of this as the pay up front option. You are going to pay higher monthly premiums, but once you pay those premiums, you don't worry about what a hospital bill looks like or what a doctor's bill is going to look like. They're just going to be covered. On the flip side of that, we have our second option, which is called a Medicare Advantage plan, or this is also Part C of Medicare. If you go with Medicare Advantage, you are basically choosing to get your Medicare from an insurance company. So instead of getting your A and B through the government, you get it from that insurance company. So this takes Part A, hospital coverage, Part B, medical coverage, and Part D, the prescription coverage, and it wraps it all into one package. This is going to look a lot more like the insurance you're used to. It's going to be insurance from an insurance company. Also, a lot of these will throw in some extras like dental, vision, hearing. If you watch any TV and you've seen any Medicare commercials lately, what they're advertising on there are these Medicare Advantage plans. So our favorite in the office is, of course, the Joe Namath commercials. So if you've seen Mr. Namath, you know about the Advantage plans. So with these Advantage plans, I think of these as being a pay-as-you-use-it option. They're a lot less expensive upfront. Premiums are a lot lower. But you're going to owe something every time you use it. So when you go to the doctor, you're going to owe a copay. Well, maybe it's $10. If you need physical therapy, it's going to be maybe $40 a visit. If you're hospitalized, maybe that's $1,600 for the hospital stay. So while you pay a much lower premium up front, you're going to pay as you actually need the services. So how do you sign up for one of these Advantage plans? Basically the same way and same time frame as everything else. If you are going to enroll in Medicare at age 65, you need to enroll in the A and B first, and then you can sign up for the Advantage plan after that. Now, if you're someone who's going to work past 65, great. You can sign up for the Medicare when you retire. And then once you've got that A and B enrollment done, then you can sign up for an Advantage plan. To find out more information about the Advantage plans or to actually sign up, Medicare.gov will be the place to go. And that's something we can help you with as well. All right, so just a quick recap on what these Advantage plans are going to cost you. So again, you have to sign up for A and B. So A does not charge a premium. B is $148.50, and you still pay that with an Advantage plan. Some of the Advantage plans charge extra. 26 is a good average number. That means the Advantage plan would run you about $175 a month. Now that compared to the $300 of a supplement. So again, you've got to pay up front with a supplement where it's higher, but you don't worry about it, or you've got to pay as you go with an Advantage plan. A lot lower up front, but you can expect those copays as you go. All right. So one last thing I do want to let everyone know about is Medicare open enrollment. And we're actually in the middle of open enrollment right now. It's October 15th through December 7th. And this is your chance every year to reevaluate Advantage plans or drug plans. So if you're on Medicare right now, give us a call and we'll help you go over your options for next year. Or a good reminder, when you are on Medicare, every year you get to reevaluate these situations. And it can really pay off. Last year, just by comparing drug plans, we helped Nebraskans save about $13 million in prescription costs. So it can make a big difference from year to year. All right, I know that was a lot of information to take in and not a super long amount of time. But if you take anything away from today and from what I have talked to you about, know that we exist, we're here. When it is time for Medicare to start, or when you're thinking about that process, just give us a call and we'd be happy to sit down with you and go over your options, go over your timeline, and really help you get a good understanding of what you've got.
If you have the time for 3 quick questions, I would love to ask them. Please tell me how this sounds. We have several coverage focused questions. And Alicia, I will let you just give general advice about how to get those answered. A lot they center around coverage when either you or your spouse is still working. So you can answer as to the best place to get those that information. And then the other 3 questions I have are, does Medicare cover long-term stays in a nursing home so you don't lose everything?
Yeah, so I will answer that one here for you. So Medicare unfortunately does not cover long-term care. Medicare does what we would consider short-term care, which is up to 100 days at a time in a rehab facility, but it does not cover more than 100 days at a time.
Thank you. May I have Part D a la carte, or do you have to have the other parts of Medicare?
That's a good question. So in order to be eligible for Part D, D like drug, you have to be signed up for either Medicare A or Medicare B. You don't have to have both of them, but you do have to have A or B to get.
As far as coverage and employer insurance, where would you start? With the employer, with the SHIP office?
So I would probably start with us. We're going to be able to give you a good idea of, here's what your employer coverage looks like. Here's what Medicare looks like. Which one's a better fit for you as far as premiums, coverage, those kind of things go. So what we'd ask you to do would be just make an appointment with us, bring in that employer information with you, and we'll sit down and we'll go over it.
Perfect. Thank you. Just because of the nature of your question, we're going to dial it down and have you talk with someone at the SHIP office. Alicia, I can't thank you enough for being here today. That we just really value our partnership with you and your ability to just connect with our clients